Hi, I'm Melissa Chalker, Executive Director of the New Jersey Foundation for Aging. This episode of Aging Insights might seem a little different to you. First of all, you see that I'm wearing a headset. During these times that we're dealing with social distancing because of COVID-19, we have to do our business a little bit differently, and that includes the taping of this show. So I'd like to take this time to talk to you a little bit more directly. We've been filming Aging Insights for 9 years, and in that time, we hope that the topics we've brought you have been relevant and helpful to you on your daily lives. But today, we're going to be doing it a little differently. Not only are we doing this via video conference, but we're also going to be talking specifically about what's on everyone's mind right now, and that's the COVID-19 virus. We're lucky enough to have 2 interviews with doctors in the field who are currently dealing with the virus, who also happen to be board members of the New Jersey Foundation for Aging. As you know, the New Jersey Foundation for Aging is dedicated to bringing you important information and resources to help you age well in New Jersey. And we hope that the interviews we've had today with our 2 doctors will give you that information that you need to stay up to date with the virus. First up is our interview with Dr. Joshua Raymond. I hope you enjoy it. Hi, Dr. Raymond. Thank you for taking the time out of your busy schedule to join us for this episode of Aging Insights and give us a little bit of information about what's going on right now. We know you're incredibly busy, so we appreciate you taking the time out of your schedule for this. If you want to first want our audience to know also that in addition to being a doctor, that you are one of our New Jersey Foundation for Aging board members. And so we are particularly grateful for your ability to join us in that capacity as well. So if you want to maybe just start out with introducing yourself and your background and the type of medicine that you practice.
Sure. My name is Dr. Joshua Raymond. I'm faculty at Rutgers Robert Wood Johnson Medical School, and I teach and lead the geriatric fellowship program that's based at Central State Hospital. I work in collaboration with a group of 18 family practice residents and 1 geriatric fellow. I've also been faculty at Rutgers Robert Wood Johnson Medical School for the last 19 years.
Great, terrific. So if you could just give us an idea of the sort of thing that you're seeing right now out there and the experience and how this is impacting your practice.
Sure.
I should say when I say it, I'm talking about COVID-19.
Right.
Yeah.
So I work in long-term care facilities, and over the last couple of weeks, we've started seeing cases coming up in the nursing facilities.
Mm-hmm.
We are currently isolating individuals, implementing gowning and wearing masks to prevent the spread of the COVID-19 virus in the long-term care facilities.
So we know that it's impacting long-term care facilities, and that it's really a concern, and the staff, and yourself included, are doing all they can to keep people safe. For those of our viewers who might be watching that are in the community, what can they do? What do they need to know to protect themselves and/or to stay connected with loved ones who might be in facilities?
Well, certainly washing your hands, remaining socially distant, not going out unless you necessarily have to go out.
Mm-hmm.
As far as people in nursing homes, so important to reach out and communicate and call them on the telephone and know that they're thinking and they're being with you, and having support from the family.
So I just really wanted to talk with you and get an idea of, what you're seeing out there and what our audience needs to know. As we know, this is sort of an ever-changing thing. So I appreciate sort of the advice and reminders about that, and getting in touch with folks because, having some loved one in a care facility and not being able to go physically there can be stressful for both parties. So that idea that you can still pick up the phone and find a way to connect is good for people to know.
In addition, reaching out to the staff at those facilities,
Mm-hmm.
Sometimes they're able to bring in and Skype or FaceTime,
Mm-hmm.
and you're able to connect with those. There are families that are actually visiting outside, tapping on the glass windows and visiting with family members. It's really touching when you see that happening.
Sure. You also mentioned, your work with the Federally Qualified Health Center, and so how are things there, and what's happening there that you can share with us?
Certainly, the way that we're delivering medicine right now is changing. Over the last 2 weeks, we've had a vertical growth in telemedicine, and we are now conducting nearly 50% of our visits via telemedicine. And it really required our staff and our doctors to learn how to do that. And people have clearly risen to the occasion. And we're nearly at the same volume that we were a month ago, and patients that we're seeing and taking care of in that setting.
Sure, because we're so preoccupied with preventing and treating COVID that we forget that there are people who have regular medical needs and might have a medical question, or they're dealing with other chronic conditions that still need management. So, the ability for the medical profession to think on their feet and the government to respond, the government and insurance to respond to the need for telemedicine has been phenomenal. I think so. I'm glad to hear on your end that you're experiencing that. Yeah.
That's right. That's
Yeah,
right.
that's terrific. So, in addition, I wanted to just see if I could get a little bit of information from you about what you think the long-term ramifications are of this, or what the lessons learned are, and what we might see once we are able to get to the other side of this.
I think preventative medicine will be more prevalent, and the
Mm-hmm.
importance of immunizations and routine health
Mm-hmm.
prevention really will be important. I think telemedicine will be here to stay. I think the
Yeah.
convenience of that and will be a legacy of this. And uh, as far as importance of advanced care planning, knowing that medical conditions can change suddenly, and it's so important.
Mm-hmm.
I think another long-term change from this will be the importance of advanced care planning.
Mm-hmm.
A month and a half ago, no one would have ever foreseen what's taking place right now.
Mm-hmm.
And really sharing with your loved ones what your wishes are in the event there is a medical condition
Mm-hmm.
where you can't express what you want done
Mm-hmm.
regarding chest compressions, mechanical breathing,
Mm-hmm.
and sharing that before there's a crisis is
Mm-hmm.
so important. Never a pleasant conversation, but it's better to do that before a crisis.
Yeah,
So
no, absolutely. I mean, I think that is a great point as well, and that lesson learned that medical decision making is such an important factor, and I guess in times like these we have to take the silver linings where we can find them. And so, if a benefit of that is that people realize they should be having these conversations with their family and their loved ones, then that's a good decision, right?
that's right.
Yeah.
That's right.
Terrific. And so, where would you direct people in regard to that, or in regard to any resources? Where can people find more information? Where would you send people who have questions or concerns?
Certainly the CDC website
Hmm.
regarding appropriate protective equipment
Hmm.
and when to return to work.
Hmm.
Also, local hospitals have helplines on their telephone. For example, if you call Centrostate
Hmm.
732-431-2000, there's a helpline there that
Hmm.
can help you specifically with COVID questions.
Hmm. Terrific. And in regard to the medical decision making, I know that Goals of Care is an organization in New Jersey that provides some resources about that all the time, but in particular, they're responding to this. So, would you say that that's also a good place for people to find resources about that?
Certainly. And if you go to their website, they're having daily webcasts
Hmm.
reviewing the goals of care conversation
Hmm.
for lay people and just facilitating the completion of a post form.
Hmm.
And they have videos to assist families or individuals if they do choose to complete one.
Great. Well, I think that is terrific information, and I do thank you again for taking time out of your busy schedule to, have a few minute conversation with us. I know this is a trying time in your field, and so I'm really appreciative of it.
Thank you, Melissa.
I'd like to again thank Dr. Raymond for joining us for this episode of Aging Insights to tell us what he's seeing in the hospitals and in long-term care facilities. And in particular, I'd like to remind all of our viewers that if you have loved ones that are in nursing homes or other care facilities, or that just might be home alone, to please do remember to check on them and call them and still interact even if you can't visit. It's very important to remain connected during these times when we're separated by distance. And now we'll hear from Dr. Vikantra Sharma, who's also going to share with us what she's seeing in her medical practice. Hi, Dr. Sharma. Thank you so much for joining us for this episode of Aging Insights. I'm really excited that you could make time for us during this. I know normally you're very busy, but I'm sure current times are making you even busier. I thought we would start with just a little basic introduction for our viewers who don't know you. Not only are you a doctor, but you're also one of our New Jersey Foundation for Aging board members, and so we're thrilled to have you with us in that, but also thrilled to have you join us today to share some information. So if you could just give us a little bit idea of your background and where you work and what type of medicine you practice.
Hi, Melissa. Thank you so much. I am so proud to serve on the board of New Jersey Foundation for Aging. It's a subject that is very close to my heart, taking care of individuals to the best of my ability about their health and wellness. And I am a palliative care physician. I work for Visiting Nurse Association Health Group and the Visiting Nurse Association collaborates with other healthcare systems to provide care to vulnerable population having chronic illnesses.
Mm-hmm.
So a palliative care physician provides symptom control and coordinated compassionate care to individuals with chronic advanced diseases like advanced dementia, advanced heart failure, advanced COPD, advanced liver disease because of hepatitis or kidney disease, MS, ALS, etc., to name a few.
Mm-hmm. Yeah, so I think a lot of people are used to hearing about hospice, and I think they have a general idea of what hospice is, but I think there's a little bit more confusion around what palliative care means and how it's different from hospice. So could you tell us a little bit about that?
So hospice and palliative care are points on a spectrum
Mm-hmm.
in the process of a disease. So chronic illness is basically that your end organ is getting affected, whether it's heart, lung, liver, because of a particular diagnosis like hypertension, diabetes, hepatitis, etc.
Mm-hmm.
So there are medications that you take on a regular basis through your physician or nurse practitioner to alleviate those symptoms, to take care of those symptoms and control the progression of the disease. As far as we can make physical changes in our lifestyle and our exercise and make dietary changes and respond to what might be our genetic predispositions, we can control this to a minimal damage state. But when the disease becomes advanced, that it starts doing end organ damage, like you start having to use oxygen for your lungs, or you need to take multiple doses of diuretics for heart failure. That situation is an advanced disease in the sense that it has already affected your end organ that was involved in the first place.
Mm-hmm.
So once that starts happening, people start becoming more dependent on activities of daily living, like bathing, dressing, walking, transferring from bed to the chair, toileting, etc. So that makes you more dependent, and that requires you to have more assistance, whether from home health aides or from physicians or admissions into the hospital, etc. So that's advanced illness. That needs a little bit more intense involvement from your physician, from your nurses, or the hospital system.
Mm-hmm.
That's what most palliative care physicians deal with.
Mm-hmm.
Now, when the disease moves into an end stage, a burnt out stage of the disease, if you will, that the end organ damage has set in, and there is very little that the medications can do to cure that disease at that point.
Mm-hmm.
In fact, a lot of these individuals, when they're in end stage, when they're on 3, 4, 5, 6 liters of oxygen or multiple medications, a lot of these medications interact with each other and cause side effects. So you're giving one to treat the side effects of the other. Mm-hmm. At that point, the medical science focus is to minimize the number of medications so there is minimal number of interactions occurring between them, and to reduce the pill burden. So our focus in the end stage is to provide comfort measures only or comfort measures mostly. So we treat the symptoms much more aggressively, knowing fully well that their lifestyle is already limited, mm-hmm. that they can't do things for themselves and so forth. So that focus is a shift
And I really appreciate understanding the spectrum as you've described it. And, I do want to touch again before we're completed with our questioning here about sort of the difficult decision of making choices, right, about how we want our care to progress. But I'd like to get a little bit of information from you about how this whole COVID-19 issue is affecting your work and what you're seeing out there with your patients and with the hospital systems that you work with.
So, COVID is definitely an immense challenge for us in palliative and hospice care. Um, we're used to, as I said, dealing with chronic illnesses
Mm-hmm.
and sort of expecting the decline.
Right.
However, we're now seeing younger individuals who don't have much of end organ damage to start with, just hypertensives or just diabetics,
Mm-hmm.
or sometimes even younger individuals with no diseases coming in pretty sick with coronavirus pneumonia.
Mm-hmm.
It is certainly very distressing. There is an incredible amount of suffering associated with an acute infectious illness that most healers and physicians feel that they can get rid of, whether with antibiotics, antivirals,
Mm-hmm.
or other symptom management drugs. And I think what is really incredibly hard for me is to address that personal sense of failure for not being able to treat somebody with an infectious disease.
Mm-hmm.
Because we don't have a vaccination, we don't have any targeted antivirals, although many trials are going on, as you know, on the medications.
Right.
It just seems that we're not in a position of control. It's an unknown enemy, so to say.
Yeah, and I appreciate that perspective from a medical professional who's attempting to treat people and attempting to do all they can during this time to keep people safe. And it must be frustrating to not have all of the answers yet. But I'm glad that you're out there with the caring heart that you have, trying to do the best that you can. And as I mentioned, you practice in hospice and palliative care, and this is a point in time where we're not sure what people are going to need in terms of their medical decision. I know recently there's been a decision from the federal government that you cannot discriminate against people on the basis of age or discrimination in accepting treatment, because we know there was a lot of things being talked about in terms of the lack of resources in treating people and how would we decide who gets treatment and who doesn't. I don't know if you want to touch on that a little bit about what you're seeing from your end in terms of refusal of treatment and things like that.
When the going gets tough, you kind of stick with the basics.
Mm-hmm.
The basics of compassion, competence,
Mm-hmm.
treating people fairly,
Mm-hmm.
treating people appropriately.
Mm-hmm.
So those are the principles we are sticking to.
Mm-hmm.
We're trying to keep in mind the individual as a whole person. We're trying to look more carefully about what their underlying diseases might be that might be adding to a rapid decline. There are scientific studies that have been done in the past when somebody is declining, and there are parameters, medical signs, lab values, etc., that we look at very closely to monitor their progression, whether it's their oxygen saturation, whether it's the intake of the oxygen that is required to maintain a normal oxygen saturation, their vitals, etc. So we're trying to stick to the basics and remain as compassionate and as competent and as fair as possible. There are challenges of preparedness, so to say. The best way to treat or to deal with an epidemic is to identify it quickly, early detection and early response. And if it is an infectious disease, you want to contain it to a limited population as far as possible. But unfortunately, because this is an unknown enemy, we don't know how to treat it, they are coming into the final frontier, which is the hospitals. Right? Because people are sick, they're afraid, they don't know what to do with it, and they decide that hospital is the best place. Again, back to the basics. Your best place to treat you is your home if you have mild or moderate symptoms. Quarantine yourself voluntarily. Stick to one room, open the windows frequently, let air out, go outside in the sunshine, make sure you're sticking to a schedule, getting restful sleep and relaxing to kind of alleviate some of the symptoms that might be coming, and certainly wipe down surfaces that are frequently used, wash your hands and don't touch your faces. Those are the regular things that we want to practice. Kind of behave as if you have the disease, which is hard to think for Americans, but I think we are in a stage that we need to behave as if we have the disease and not overexpose other individuals, because we know that this disease has an asymptomatic carrier state in younger as well as older individuals. Although the people who are far advanced in age, 80 years and older, have much more severe disease easily, because bottom line, they have a more number of chronic illnesses that are at the baseline. So it's a complex play of all these diseases that acts up. I think so far, I haven't seen that we have come to a resource allocation kind of thing. I hope to God, and I'm optimistic that we will do the right thing even now and prevent that stage from coming, that we have to allocate respirators or healthcare supplies, etc. But I think one of the most important things that community dwelling individuals can do, community dwelling means outside of the hospital, outside of the last frontier, so to say, is that we think about what can happen and pay attention and plan ahead. So if you have an unknown situation, you want to plan ahead. So in this situation where people are sick with other diseases and they're afraid that they might contract COVID-19 and have devastating consequences, they have to think about what is important for them, what senses, what function is important to them, being able to breathe on their own, being able to think on their own. If they're progressing to a point that it is not salvageable, if they're going, do they want to be on a ventilator? Do they want to be in a hospital at this time? Right. Is CPR going to be helpful, or is it going to be just prolonging the inevitable? Those kind of questions need to come in. So individuals who are at home kind of need to have a general care plan about understanding of what their disease process is and what they would opt for, what kind of intensity of treatment they would opt for. And people who are in nursing homes, or if you have loved ones in the nursing home, I think it behooves them to understand that this is important to address the goals of care now, rather than if they are diagnosed with acute respiratory illness and need to go into the hospital.
Right. Yeah, I appreciate that so much. Both not only the wonderful advice you've given about staying home and about the precautions to take, but also that last bit there about medical decision making, because we do know that it is important at any time to know what your choices would be or how you'd like to be treated if you're ill. And so I think in somber times like these, it is important to make sure that you've had those conversations, right? And
now more than any other time, it's really crucial to address your healthcare proxy and tell them, I never want to, be in a hospital, in a nursing home. I don't want to, that doesn't need to be the last place that I need to be. I think healthcare providers, physicians, and nurse practitioners specifically are telling their loved ones, because we are exposed to this almost on an everyday basis every time we enter a patient's room.
Right.
So I think we're more mindful. I think we're more thoughtful about it. And if we take the time to reflect on it, I bet that what is most important to us comes up forefront.
Again, I think that's terrific advice. As you said, it is easier sometimes for those that are in the healthcare field to have those views and to understand that line of reasoning. But we hope that everyone takes that advice to heart and does think about this and take the time that we have now to really reflect on what matters to you. So, Dr. Sharma, I truly appreciate you taking time out of your busy schedule in all that you're dealing with to talk with us and share this information. And I know it'll be extremely valuable to our viewers. So thank you very much for joining us today.
Thank you.
Thank you for watching this episode of Aging Insights. I'd like to again thank not only Dr. Raymond for joining us and sharing such relevant information, but also Dr. Sharma for taking time out of her busy schedule to share some information and advice with us. I do hope that you heed her advice on how to keep yourself and your loved ones safe during this time. And I'd like to also remind you that if you are still in need of services, you can still reach out to your county office on aging, and you can reach them at 1-877-222-3737. As always, we try to strive to bring you relevant and important information through the production of Aging Insights. The New Jersey Foundation for Aging would like to thank all of our first responders and medical staff and everyone on the front lines for keeping us safe during this COVID-19 crisis. And we hope that you'll continue to stay with us and enjoy the content, even though we're bringing it to you in a slightly different format.